An area of plastic surgery that I find very rewarding is the revision breast implant procedure. And I see more and more of these types of cases from women who've had implants for oftentimes a long time and find that they've become either too large for them, or they've had problems with their implants and need some sort of adjustment, particularly with the position of the implants and or the improving the softness of the implants. And this is a nice lady whom I saw a year ago or so, who had relatively large implants and developed some sagging over time, and they feel very firm. In addition, you could clearly see kind of the edge of the implant, which is very characteristic of a capsular contracture. And so we decided that we were going to make her implants a little smaller and lift her breasts, and also reduce the scar tissue so that the firmness of the implants would resolve. And you can see the improvement in the front view of this patient. The side view shows even more nicely how much improvement in the naturalness of the breast and also the fullness in the upper part of the breast was achieved by going to a smaller implant and then doing a breast lift. So this is a very common type procedure in my practice. And I thought you would be interested in seeing that. So thank you.